Hello, everyone. This is Dr. Clark from the Center for Hormone Health and Wellness. And I want to discuss just for a minute about estrogen and men. Now, we often think of testosterone as the hormone for men, but do men need any estrogen? The short answer is, well, yes, but it's not like men make estrogen. The estrogen in men comes from as the testosterone breaks down. Some of it breaks down to estrogen. And so what we'd like to have is the right ratio. Okay? And what I mean by that is I typically like to see about 5% or less estrogen of what the testosterone levels were. So if your testosterone level was, say, 1,000, we'd like to see that estrogen level then at about 50 or less. You don't actually want to have zero. But when men's estrogen level becomes a little too low, they become a little more edgy. But also, if on the flip side of this, if the estrogen level gets too high, we tend to be a little more emotional. They may develop actually some symptoms, such as a little bit of breast discomfort if their estrogen levels are high, or if the estrogen levels get high in relation to the testosterone, subsequently they may feel like the testosterone levels are low. And actually, their testosterone levels may be high. So even if they don't have that sensation, they have good testosterone levels, it's potentially due to the estrogen levels being a little bit too high. So, yes, we want to keep track of estrogen in men, but it's not like we're treating men with estrogen. The estrogen comes from the breakdown of the testosterone that men readily make. But as we age, our testosterone levels tend to fall. But the flip side is that as we age, then more of that testosterone is converted to estrogen. And we want to keep the right ratio. You have further questions? Just give us a yell here at the Center for Hormone Health and Wellness. The phone number, 757-223-0940, or just stop in and visit us at 711 Brick Kiln Boulevard in Newport News. All right. Again, have questions? Give us a yell. If not, you have a good day. Take care.